Hi, I'm Zoe Armstrong. I'm the Service Delivery Director for Autism Care UK. I've worked for Autism Care UK for coming up to 12 years now, and I'm delighted to be here today listening to Professor Tony Attwood speak at Lincoln University. Tony's actually been kind enough to agree to us asking him some questions outside of the conference. The first of which is, you talk about autism friendly environments. Can you tell us about some of the characteristics of these, please?
An autism-friendly environment has one of the major components being attitude to someone with autism. And it's an understanding that they are different, not defective, not necessarily stupid, and that they have a different way of perceiving the world. So for the first thing I look for in autism-friendly is the attitude of people. Some people get it and some people don't. And those who do, life is a lot easier for those with ASC. The second is an environment that does not have causes of sensory sensitivity for those with ASC. So in other words, they don't have sudden loud noises or noises of a particular pitch, etc. It's also an environment where people say exactly what they mean and don't use sarcasm, irony, metaphor, all those sorts of things. They're very direct. It's also where they understand that the person with ASC takes time to process instructions, social requirements, facial expressions, etc. So being patient with that individual. It's also an environment where they recognize the learning style, the social needs, and sometimes that person with ASC needs solitude, and it's not being neglectful of that person, they just need time to chill out, to be on their own, and they will need that throughout the day. It's also recognizing the intense emotions that can occur and to provide an environment of emotional stability and understanding. Not too many changes, not too much in the way of intrusion into that person's personal space, and enabling that person to feel, I can relax here and be true to who I am. The real me can come out. And that's what I'm looking for in an autism-friendly environment.
What would be your advice to family carers whose son or daughter has autism and ongoing care needs who are looking for a supported living provider?
We're dealing here with adults, and sometimes for parents, for various reasons, they have supported that person knowing sometimes it's easier to do it for him, or I've got to always be there, and so on. And it is a very brave parent who can sometimes back off and let the person try it themselves and be prepared sometimes for it not to work. When we look at the success of those with an autism spectrum condition, two areas come out as more important than any other. That is daily living skills, the ability in budgeting, to be independent, to have all those sort of characteristics of living without too much support. The second area is in terms of emotion management, to be able to cope with anxiety, depression, or anger, and having support on that. As an adult, the person may be able to create a social environment within their social capacity. They may not be having to learn so many new things every day as they did at school. There aren't so many new aspects of their environment. So I ask parents to encourage independence, but also to encourage emotional stability.
Today you're giving a seminar on Asperger's syndrome and managing emotions. What are some of the commonest emotional difficulties faced by people with Asperger's syndrome?
One thing that those with Asperger's are very good at is worrying, and they tend to be very anxious people. And so in being anxious, the person can be a little bit controlling in their life, not maliciously, but just to prevent anxiety-provoking situations. Can be a bit passive-aggressive at times, or emotional blackmail to make sure that what they anticipate is going to occur. Also in anxiety, there can be routines and rituals that they impose, again, to calm down. Sometimes they have an explosion, as what I call an emotional cleansing, to feel better. Sometimes it is, in terms of the special interest, being a thought blocker to help. But other emotions that will occur is depression. And that can be because of the person thinking that they are inferior, that they've had a lot of negative experiences in their life and that degree of despair, especially from bullying and teasing, not fitting in, not being able to achieve the employment and independence that you feel you should have, can make that person feel depressed. And when life is not consistent and you're not valued, you can have anger at the world for not giving you the respect that you really deserve. There's another emotion that we work on, and that is affection. And it's understanding why neurotypicals are such fragile flowers and need lots of affection. Because the person with Asperger's and autism can cope with far less affection, and in a way they can't understand why people need to be told they're loved so often and why they want to be squeezed. It's called a hug. And so part of the work with both the children and especially the adults is understanding about emotions within themselves and others, how to express them appropriately and how to manage them.
If you could change just one thing about society's preconceptions of autistic spectrum conditions, what would it be?
I think people with autism are heroes. I think if you could be autistic for a day, you would completely change your attitude. They cope, they strive to cope in a world of social zealots. And if I was going to change one thing, it would be appreciation of the challenges the person faces, and not to assume that they're stupid or to assume that they're bad or naughty. A lot of things that they do are just coping mechanisms with life. So if I was going to change anything in attitude, in life, it would be attitude to such individuals. And sometimes attitude, dare I say this, is free. I know there's a limit to what government funding will provide, but you can make a dramatic change in that person's quality of life by attitude. It's free.
Recent research has shown that many people with severe or profound learning disabilities may have undiagnosed autistic spectrum conditions. What are the implications of this for care and support providers?
The diagnosis of autism spectrum conditions is changing over time. We're identifying at the upper ability range, Asperger's syndrome, but also those with learning disabilities. That previously, when that learning disability was identified, that was the end of the diagnostic process. Oh, he's got learning problems, he's intellectually disabled or whatever. And we're now recognising that that was only the start. We've got to look at the pattern of learning difficulties, the social confusion, the language profile. And then when that person has a more accurate diagnosis, not only does it lead to better understanding, but you then have access to programs and resources specifically designed for such individuals. So I think it's very good that there is now a more accurate diagnosis, and realise that you can have Down syndrome and have autism. You can be blind and have autism. In other words, it is not an exclusive condition. It exists as a dual diagnosis with other problems as well. And as we explore chromosomal abnormalities, all those sorts of things, one of the characteristics we look at are now autistic-like behaviours in a range of chromosomal abnormalities.
You talk a lot about celebrating the gifts and talents of people on the spectrum, and this is something that we focus on at Autism Care UK. What are practical ways that support staff can do this in their work with individuals?
The person who has an autism spectrum condition has a brain that's wired differently. And in a way, that means that there will be some skills that they do better than others. That's the way the brain works. We've got to find those, because they desperately need what I call the wow factor. That is something that they can see is better than others. They're not being patronising, they're genuinely approving and appreciating a particular skill. So once they have that skill, it may lead not only to improved self-esteem and a change in attitude from other people, it could be a potential career. So we're looking at what the skills of that person are. It may lead to friendships and sharing that skill with people who would benefit from it or have that same ability, say in the art world, for example, or train spotters, so that you have someone who has a sense of culture or identity. But also the special interest is something that gives the person status amongst others, to be respected and valued. So sometimes we have to look hard, but eventually we'll find it.